Hello, my name is Vinciane Quoidbach. I'm from Belgium and I'm working for the European Brain Council as a research project manager, public health and policy.
My name is Bernadette Sheehan Gilroy. I am a lecturer at Munster Technological University in Ireland. I'm a PKU researcher and advocate. So we had a really great opportunity to get involved in a research project with the European Brain Council on the usefulness of digital tools for the PKU community, along with my colleagues from Spain and from Germany. And being a patient advocate, we were able to provide further insight, that could be more meaningful and impactful with this research. So we're very grateful for the opportunity.
And actually, we've been very happy to be working with patient groups all along the projects that we have had on different case studies. We looked at rare brain disease in general, but for the study in particular, we had ataxia, dystonia, and phenylketonuria as the focus of our study. We were looking at, of course, the design of the care pathways for patients, but also in particular, since the COVID-19 pandemic and the process of accelerating the remote care, telemedicine, etc. We wanted to look at what were the patient needs all along the sequences of this particular care pathway, and with this emphasis of looking at the need for digital tools for more education, more communication and information, but on both sides, actually, the patients, but also healthcare providers. Well, in terms of the questions, it was a co-creative process, as I just said. We did it really together with a working group that was set up with patients associations, and also healthcare providers. Of course, the European Reference Network MetaBern for rare neurometabolic disorders was also with us. The exercise was really to capture the good questions to address to patients and to healthcare providers to see how and why those digital tools would be beneficial for patients in terms of education, information and communication, and also particularly looking at the optimal care pathway, of course, for better outcome, but to look at how this could improve actually care for patients. But on the other side, we also noticed that at the end, it's also beneficial for the healthcare systems as a whole.
I suppose from a patient perspective, we were really lucky to complement this research with permission from the European Brain Council on the perspective of the PKU community from 3 countries, Germany, Ireland and Spain. And it was very beneficial to understand that whilst digital health is important to patients, in-person care is more important to the majority of patients across these 3 countries. I think it's important to mention, that with digital care too, it was highlighted amongst our discussions that we need to be careful, proceed with caution with digital health tools, that we should definitely co-design, co-develop digital tools with patient communities to avoid situations like over-monitoring of conditions, helicopter parenting, for instance, also for discrimination that may occur with accessing mortgages, job applications, health insurance, etc. for these patient populations. And you really can't overlook face-to-face communication with your healthcare professional. You build a relationship over time, and this is hugely important for patient communities. So whilst we do very much value digital health tools to support our community, we also are very cognizant that we need to do so with caution.
As I said, we did actually this scoping review on what were actually the digital tools that were used during the pandemic to really address the complex needs of patients with rare brain diseases, and we wanted to see, okay, there is a transformation here. Can we say that using digital tools is really part of the health transformation? Can we assume that there is a real benefit not only for patients but also for healthcare providers and for the health systems as a whole? So we started with those questions, and the feedback that we received was actually what we, in a way, I expected, is that patients are in favor of using digital tools, although they would not refuse to have a physical appointment with the health providers. On the other side, digital tools are not substituting, they are actually complementing, and that's actually the purpose here, is to have access to data related to results of any diagnosis, especially in the case of PKU, monitoring of blood samples and the continuity of monitoring the patient with regards to the dietary management, with regards to also novel therapies. So yes, in general, patients were positive about the fact that using digital tools is beneficial. With regards to education, also it's a plus, because in a way they have access also for any age to education through webinars, through trainings online, and it's also a plus. We know that in terms of data sharing with the European Health Data Space and with the new Artificial Intelligence Act, we will go into more digital, more data sharing. We have to be aware. We know that it's an added value, but we also have to be cautious, as Bernadette said, and confidentiality of the information, it needs to be really upfront, and also anything that can be used has to be under the consent of the patient.
So early engagement with patient communities is hugely valuable and very important in care pathway development. I was involved in co-leading the care pathway development in Ireland for phenylketonuria, and I think that was a hugely valuable experience because we need to understand exactly what the needs of patients are. So here at the conference today, it was highlighted at one particular stand which areas that we should be engaging and concentrating on for best possible care outcomes. And what was missing from that board, I couldn't help but realize, was families. So you can do all the research in the world, you can look at government systems, you can tackle issues around healthcare resourcing, but if the neurological support is not provided to patient communities to help to support them, to bring them to a platform where they are in a place where they actually can communicate effectively and very early on. So as a patient advocate, I have been invited to comment on models of care and to speak at different events, but it's really important that this happens from the onset. So before a project commences, like a care pathway in individual countries, they may have very specific needs for their patient populations within those spaces. But for PKU specifically, one area that needs to be targeted, I'm very cognizant that we're at a neurology conference, is the area of psychiatry and psychology. So PKU is very much affected on the neurological front, but yet it's very much concentrated in the area of metabolics. So we forget that it's neurometabolic in nature.
Can remain patient-centric, and that's actually the purpose, is to ensure the continuity of care, but also the continuity with regards to monitoring. So remote care was actually a solution and was actually considered as a best practice during COVID-19. We also have seen the positive effects of doing so in terms of managing phenylketonuria and also monitoring the disease on different aspects, dietary, and also in terms of the use of novel therapy, but also on any type of blood test or anything that needed to go to the lab or that's, yeah. Phenylketonuria, it's not only a child's disease, it's also an adult disease. We have actually with this disease a sample of many categories of patients, so it's actually very interesting. When we're talking about children, it's of course the parents or the caregivers that are really involved into the process of the healthcare providers and the patient relationship. But it's true that it's actually remote care was actually able to complement what wasn't possible at the time of the pandemic.
during the pandemic as well. One study actually demonstrated across 3 continents that 60 to 80% of services in inherited metabolic disorders were affected. And this is something that digital health tools could really support. In Ireland, we have a telephone service, a text messaging service for paediatric care. Unfortunately, it hasn't been extended to adult care for phenylalanine levels for monitoring, which is really effective. I think it would support patients as well. Right now, there's delay in receipt of blood levels. This is something across PKU for both children and adult care that really would help to support management of the condition. So right now, in one family reported in Spain, they wait 3 weeks for their child's blood levels. I know in adult services in Ireland, you wait up to 10 days. So the latest draft of the European guidelines recommends 2 days. The last draft was 5, but it's now down to 2 days. So this can only happen with digital health for optimum care for patients with this condition.
We just released a report, study insight on the use of digital tools for rare brain disorders, the case of phenylketonuria, but of course it can be also adapted to other rare brain diseases because we address complex needs and at the right time with the right people. So definitely we could adapt it.